Our March Prince George's Health Action Coalition quarterly meeting. It is so good to see you all. The last time I saw you, we were all decked out in our red for the holidays at our December quarterly meeting. So good to see you all with some sunlight still out and about. Certainly hope everyone is doing well, and thank you so much for joining us this evening. I will go ahead and pass it over to Dr. Levy and Dr. Little to read off our agenda for tonight.
Ahead, Dr. Little. Kick us off.
Oh, you want me to kick us off? Okay, I will. So tonight we will review the Prince George's County Health Department if you could mute your phone, that would be great, or mute your laptop or tablet. So we're going to make sure that everyone is up to date on where the health department is with the strategic planning and the community health assessment. So if you haven't heard, you'll hear about that tonight. We'll also go over the Prince George's County Health Zone, which is a space that you can go to get data on Prince George's County in terms of health data and other data related to social determinants. And there'll be a tutorial around that. And then we'll also have some time for community announcements. So I'm going to pass it over to Dr. Levy to kick us off with the updates.
Good evening, everybody, and thank you for joining us today. And I want to thank Taylor for continuing to drive us forward and making sure that we're on track. So Taylor, thank you. And I also want to thank all of you for being here and partners with the health department in driving change. So we always start with our vision and mission and values, and all Prince Georgians are their healthiest at every age and every stage. And our mission is to lead, engage, and empower our community to work collaboratively towards disease prevention, health equity, and total well-being. And this is our new-ish now, not new, not completely new anymore. But we continue to drive towards this vision and mission. And we do that by following our values of equity, diversity, and inclusion, respect, teamwork, accountability, innovation, and excellence. So I wanted to just give you a quick update because we got so much stuff going on at the health department. Besides the craziness that's happening around the country, we are moving forward. We are driving forward. Our team is excited. We completed our employee and partner focus groups and surveys, and we had a lot of input from both you and from our own employees. We've identified 4 priority areas, and then we are taking those 4 priority areas, and we've created. And now this strategic plan is sort of an internal, external facing, and it's complementary with what we get when we do the CHIP, which is going to be informed by the CHA. And also then leading into our QI plan and our strategic implementation plan. So we have these 4 work groups working on these priorities, and they are excited about it. We followed a model that we've all sort of been embraced in the health department around the high performance organization model. It's called a parallel organizational model, meaning we bring folks from all different aspects of our organization together to solve a problem or to give recommendations. So we did this with the 4 priorities. We brought people from different parts of the organization together. Leadership took a half step away so that we could have this be driven by the folks on the front line, in the back office, and really folks in the whole health department driving this to create not just buy-in, but because we also brought some of these are folks that have lived experience and understand the organization, been here for many years. So we brought them together to try to create the goals and objectives. We're learning about what they've come up with so far tomorrow, so we're very excited. It's a surprise for most of us. what's coming. So we're also helping to guide the process. So it's not, they're going to come with, we're going to shoot a rocket to the moon. I think they're going to, give us some really good stuff. I'm very excited to hear that. And the idea behind this is then to go into our objectives and have a framework of strategic plan done by the end of the fiscal year in June. And then we will take that and move into our aims and action plan. And that will link hopefully directly to our CHA and our CHIP, or the CHIP rather, to be that being formed by the CHA and all that information that's coming, that we're gathering now. So I'm excited because I think these are going to come together really, really nicely, and hopefully there'll be two parts of the same whole. And we're going to be reaching out, and we're going to need the community's help to drive change. We're moving towards a model of Public Health 3.0 as more as a chief convener and a chief strategist, and a sort of a data analytics center, as well as sort of looking for funding to reach out to the community. So it's a change in what we do, and we're going to evolve slowly, but we're going to be evolving so that we can serve more people and really work and leverage the great work that all you're doing to drive change. So again, thank you for your partnership in working with us, and I'm going to pass it back to Taylor unless anybody has specific questions. Okay, Taylor, back to you.
All right. Well, I'm personally biased because I'm actually a part of one of the work groups for Chief Health Strategist, and really looking forward to the group's presentation tomorrow and to see the plan in action. I know, I've talked to several of you about our partnership with the health department and what does that look like. And you all have expressed the same thing of needing to know better what is going on across Prince George's County. And so we certainly hope that that strategic plan will be an important tool in driving that forward and hopefully best meeting the needs of our community. In terms of meeting the needs of our community, I'll also spoil our community health assessment. So we have told you all several updates throughout the past months. In our last December quarterly meeting, you all got this update of where we were at. And so we want to continue up until we will have the community health assessment completed in late June. So between December and now, we've been working hard at the primary data collection and some secondary data analysis. So on the primary side, we've conducted key informant interviews with several of our community partners. So I want to do a huge thank you to everyone on this call. You all sent us great community partners. Some were involved in those interviews. And so want to thank you all for all of your feedback that you've given us. We wanted to focus this community health assessment and talking to several of our subpopulations here in Prince George's County. So we were really able to dive deeper into the needs of all Prince Georgians through these key informant interviews, and to figure out, again, as a health department, what can we do to best address the needs of our residents. So I'm looking forward to putting that final report together. To do so, we are also complementing our primary data with some secondary data indicators. So that will be a good time for us to do a follow-up from our 2022 community health assessment to take a look at how are we doing as a county trend-wise, and what do we need to prioritize in the next few years. And that will really help us to put together that CHIP document that Dr. Levy has been talking about, the Community Health Improvement Plan. As you know, the work groups have been a fundamental aspect of that Community Health Improvement Plan, and carrying out different programs and initiatives alongside the health department to address the health priorities that we identify in the Community Health Assessment. The last piece, but certainly not of least importance, of very, very much importance, the community resident survey. The survey will be opening very shortly. We have a flyer for you all to share with a QR code. We have translated the survey to French, Spanish, and English. So we will share that with you all to share with your networks. It will be available to anyone who lives, plays, works, worships in Prince George's County. We want to hear their input again about what are our strengths, what are we doing really well with our resources, and what do we need to do better moving forward. So we recognize that it takes us all, and so we want to make sure that we have that resident survey available to as many as possible. So we will be sure to get out that flyer to you all if you can share it with your networks, and that'll be closing in early April. But I will be sure to follow up with you all after this meeting with our announcements, our meeting notes, and those flyers for you all to share with your networks. Any questions, or Deborah, were there any updates that you wanted to give about the community health assessment?
Nope, I think you covered everything.
All right, and Miss Cheryl, I see your hand. And you're still on mute.
Good evening, everyone. I need to share something with you. I just came back from the giant food store here in my community, and there was an elderly woman, not when I say elderly, perhaps somewhere 60th, between 60s and 70s, okay, mid 70s. And the carton of eggs was $13.99 that she was buying. She was so taken back standing at the register as she watched someone hand a voucher to a cashier for their groceries, that she kind of lost it and kind of just out of her fury screamed, how is it that people who aren't, to her mind, who aren't paying the taxes that she's paying, who don't have the life circumstances that she's now facing, how are they getting by or over, as she put it, while she couldn't get the milk that she needed or the Crisco oil that she needed. She could only get the eggs because the eggs are $13.99. And it made me think, my gracious, we're just in the first 6 months of this administration, and what will be its impact by the time we're in the second, third, and fourth year? And I thought to myself, maybe we should include something where at our community stores, they may have posted or may have available information about pantries or ways that customers who are finding themselves unable to purchase the foods that they need, maybe possibly where they can get some support. And I'm wondering if our community stores, if they're not doing it already, would be willing to do something like that. And how do we put that in the language of our assessment so that if other people think that that may be something we need to address, we can include it. By the time I left, I was in tears.
Cheryl, thank you for sharing that. And we all see this, we're seeing this, and I agree with you. We live in incredibly uncertain times. I love your idea about trying to talk to our food stores and see if we can make sure that if people can't afford those products, that there is an alternative strategy. And maybe we can bring that back, Taylor, and start to think about how we would work with the community to address this. I don't have the words for it, to be honest. It's unconscionable in my mind. And go ahead.
And I was going to say, after her momentary breakdown, it was clear she wasn't trying to hurt anyone's feelings. It's clear that she's not saying, go home or go. That wasn't the issue. The issue is that people are I don't recall the last time I bought a carton of eggs, but to think that for one carton, $13.99, I mean, that just blew me. And as I watched her, if people aren't expressing it outwardly, I know people are beginning to feel it. I feel it. So thank you so much for saying that this is something possibly we can include or look at it being important enough to see how we might address it.
Thank you, Ms. Cheryl. I think you just illuminated the need again for the health department and our perspective of becoming the chief health strategist and really embracing all of our partners and across all sectors. That it's going to truly require us all in this. And we're going to have to start getting creative and how we get our programs out there and how we let folks know about the resources that are happening. And so we need all of you on the call today to let us know your experiences on the ground and to let us know what you are seeing and what you're experiencing, and then also the resources that we know about. And so we can hopefully get those in the hands in the hands of as many partners as possible to increase visibility. And so all Prince Georgians know that there's support out there and that we certainly will not leave them behind. Any other questions or comments? All right, great. Well, again, thank you all so very much for all of your support during the community health assessment process. Truly, this community-owned and community-led document would not be possible without you all, and we look forward to providing you all with this report in the next few months. All right, and so next, that leads us to the bulk of our meeting today. We have an overview of PGCHealthZone. So for folks who may be new to the coalition, we use PGCHealthZone as the site where we collect we have data available. Folks can go on and look at several different data dashboards. We have all of our coalition resources. It's how we are able to keep connected with community and get out resources and different announcements. So if there's ever a chance, Ms. Cheryl, we were talking about food pantries, if there's ever a chance that we could elevate those pantries on our website, please do let us know. We want to make sure, again, that this is a visible platform to all of the community so they can take a look and see when they are making asks for different grants to support the community, that you can take a look at the data available. You can take a look at all of the resources that we have available, our different providers. And also any additional information to get involved in our work groups. So tonight we are joined by Conduit, who is going to be doing a overview of the website so you can all see the wonderful resources that we have. So before we get into that, I want you all to consider the following questions. So first, how can your organization implement various PGCHealthZone data resources? And two, what resources can we add to enhance the site? Again, this is a website that we want as many community members to be able to access as possible. So we want to make sure that it is accessible and usable by all of our community members. And it also has the content that you all need. So if there's something that is missing, please feel free to name it tonight. And if you have any questions for any of our presenters, please feel free to add them in the chat, or we will have time at the end for specific questions. But without further ado, it is my honor to introduce Tammy, Ashley, and George tonight for our presentation.
There we go. Thank you so much, Taylor. And we are so happy to join you all this evening. Welcome to the PGCHealthZone dashboard. This dashboard can be accessed at pgchealthzone.org. As Taylor kind of mentioned, this dashboard pretty much creates a common place for data to be obtained, allowing individuals within the county and the community to access information that can help improve overall health, as well as quality of life within the community. As you see on the page, here you can find a centralized public platform to share health and quality of life data using data visualizations. On the homepage, you have a lot of easily accessible resources that can just direct people directly to data that they are looking for, such as the Healthy People 2030 tracker, a demographics dashboard, or even the community dashboard that we're actually going to jump into first. The community dashboard here that I have pulled up. Perfect. So from here, the community health dashboard is where you can complete a detailed search on the data on the site for all the data available. There are a couple of ways that you can search to find the information that you are looking for. The first option is to search by typing in a keyword. I know Michelle was talking about the individual being distraught about eggs in the grocery store. So let's say you want to learn more about indicators related to poverty. You can come in here and type in poverty, enter, and then see here, it will pull up all related indicators that you can jump directly to or show on a dashboard related to poverty. On our platform, the indicators that you'll see as we go through this demonstration, we have indicators listed as something that describes an aspect of the population. So that is where we will use this to measure health or the quality of health. In addition to searching by keyword, you also have the option of coming over to this drop-down arrow menu here, where all the indicators on the site are organized by health topic first, and then subtopic in alphabetical order. And then last but not least, over here to the right, we have the option to search by location. So all locales start with the largest location first. And then as you scroll down a little bit, you'll see that we have areas by zip code as well as census tract. So let's say if you are coming to the platform, you're not entirely sure of what area you have interest in or what area you want to focus on directly. We have this nice map feature here where you can use a map to select the location. Coming in over here, and let's say for census place, I know a lot of people don't know their census places. You can click into census places, and then the map will automatically map out and line up all the census places available. And then by clicking into one of these options here, it will take you directly to that census area where you can see indicator and data specifically for that. Okay. In addition to the search features, we also have some pre-built dashboards. All of these dashboards focus around a specific topic area. As you can see, there are brief descriptions about what those topic areas are focusing on. And when you click into the actual dashboard, it will give you more information on the specifics around those indicators that we have created the dashboard for. So one of the first dashboards I will take us into is the all data dashboard. This dashboard pretty much contains all the data indicators at all locations. And I kind of have that pre-built in up right here. So again, the all data dashboard displays all the data available on the site. The indicators come from both national and state sources, and the sources are updated annually. Within this all data dashboard here, you do have the option of changing the location that you are looking at. So currently we are looking at all the data for Prince George's County. However, if you want to be more specific and look at a zip code, let's say 20705, when you click into it, the dashboard will update. And now you are looking at all the data available for the zip code specifically. As we scroll down a little bit more, you'll see that the data is organized by 5 main topic areas and then a series of subtopic areas alphabetically. And then when we kind of come over to our right, you'll see that you then have the value available for the indicator, the measurement period, so when the data was collected, and then some comparison values that are available for that indicator we are looking at. Over here to the left, you'll see that we have this legend that is pop in and pop outable that allows you to see more of a breakdown of what the icons and colors and graphics are actually showing in regards to the actual indicator you're looking for. So this kind of gives you a great breakdown of letting you understand what the values are saying and how it compares to, let's say, other Maryland counties, other Maryland zip codes, or even other US zip codes altogether. And then in addition to that, in this bottom right corner here, we do have a very helpful Help Center article that takes you to another site that will give you more of a breakdown of the comparisons that you are looking at. So just to kind of go into one of these, for example, looking at this first comparison here, it is the adults with cancer. You'll see that the value here is saying 5.4. And then the period that it was collected for was 2021. This first icon here is gauging this value compared to other Maryland counties. It being in the green right here is indicating that this value is in the best half of the communities that is compared to. Same thing with in comparison to other Maryland zip codes, it is also shown in green, and then also to US zip codes as well. And then when coming to compare it to a single value, compared to Prince George's County value of 6.0, this being a 5.4 and trending down, and is indicating that this is a good thing, that it is trending down, which we have it as a green, as well as compared to the US value of it being 7.0 and this being 5.4. It being down is what we're considering a good thing of adults with cancer within this area. So the all data dashboard, again, just gives you a quick snapshot of all the data available and gives you a great idea of what it looks like in terms of what the values are being compared to. In addition to the data on here, we also have a great feature right here, right under the legend for locations, where you can click the card view. So this card view is a great way for you to kind of change the indicator and turn it into a downloadable graphic. These graphics are great when you want to use within a report, grant writing, or even presentations. So here you'll see that it's the same indicators that were listed before, but just kind of all consolidated onto one card. This card can then be saved as a JPEG and then shared. In addition to the card view, we also have an option for those who are visually impaired, where you can turn on colorblind mode. Then when you turn this on, you'll see that there is a thumbs up or thumbs down next to those comparisons that are in red and green, so that if you're printing out in gray or sharing with people who may be colorblind, they can see comparing favorably or not favorably with the comparison values we have. So this is the all data dashboard. Another dashboard I would like to show you is the disparities dashboard. So we'll come back to the community health dashboard, scroll down a bit, and then come to disparities dashboard, which I do have pre-populated. Awesome. So another dashboard I wanted to highlight for you, of course, is about disparities. This is where you can view indicators with breakout data such as age, gender, race, and ethnicity. So this shows the differences within the subpopulations. So this particular dashboard pulls every indicator, currently have a filter for Prince George's County that has data for subpopulations and subgroups. So for some of these, you'll see that we can always, again, reference the legend to give us an idea of what we are looking at and understanding what the colors are saying, whether things are considered significantly better, worse, different, that there is no difference at all, or that there isn't data currently available. For some of these, you'll see that there are blue, reds, and greens, meaning that they have confidence intervals to say whether or not they are statistically significant in terms of a difference. And then again, if we do not have the confidence intervals, they would just be gray and the data will still be available. Another great thing about this dashboard is that all of these graphics can still be downloadable as either a JPEG, PDF, or a CSV file. So they can also be shared for presentations, grant writing, or even through email. And then similar to the all data dashboard, this disparities dashboard can also be turned into card view. Anyone to load? There we go. Can we turn into card view, where you can see the same information just consolidated into a card, and then each of these cards can be downloaded individually for presentations. So now that we've kind of gone through a few of the actual disparities, the dashboards, as well as the data available, let's actually go into searching for an actual indicator and looking at what the indicator detail page looks like. So for that, we can come right back down to the community dashboard itself. And then for the indicator, I'll say, since we were also talking about poverty, let's search for an indicator related to that. Okay, and let's go with people 65 plus living below the poverty level. So you can go ahead and click into this. We'll have it specified for the county, which is Prince George's County, and then it will pull up the indicator detail page. So the indicator detail page is designed to give you more information about the specific indicator, including values for specific locations, changes in values over time, and details about different subpopulations when they are available. At the very top, you'll see that we have the indicator name, as well as a drop-down option for you to actually toggle between other indicators where available. Right below that, you have the geographical area that we are looking at. So right now, we are looking at this indicator for all of Prince George's County. However, if you want to be more specific and look at it for a specific zip code or even a census tract, you can also select that through here. And then right here to the right, we have the measurement period. On the indicator detail page, it will automatically show the most recent measurement period for the indicator available. However, if you want to look at more historical data, you have the option to toggle through previous years to see how the data was showing previously compared to how it is showing now. Okay. Right below the indicator title is where the county and the measurement period, we do have the definition of what the indicator is measuring. So for the specific indicator of people 65 plus living below the poverty level, this indicator shows the percentage of people aged 65 years and over living below the federal poverty level. And then we also have our measurements here of letting you know how the value is calculated for this. So the numerator equals the total estimate of persons age 65 plus who had an income in the past 12 months that was below the poverty level over the denominator that is a total population estimate age 65 plus with poverty status determined. Right below that, we do have this very fun box here that is showing why this indicator is important. This information can definitely be pulled for, again, grant writing or even presentations, but this pretty much gives a quick summary of why we consider this indicator important and certain details that can kind of support why more information into this indicator may be relevant to you as you are looking for data within your community. As you scroll down a little bit more, you'll see that the indicator that we're looking at stays with us at the title, and it brings you more down to the more detailed area. To the left here, it shows you the geographical area we are looking at, which is still Prince George's County. We have the value of 8.8. Next, we have the source, so where the data is coming from. So this is coming from the American Community Survey 5-year survey. The measurement period, again, is showing from 2019 to 2003, which is mirroring what we have here. This source is, this page is maintained by Conduit HCI, and it was last updated in February of 2025. As we come over here to the right, you'll see that we'll see some of the same comparisons that we saw on the all data dashboard. However, on this page, as you hover over each of the different icons, it gives you more information of the context about the comparison, such as like the cutoffs of the quartiles, as well as additional technical notes. As you scroll down a little bit more, you'll see that we have a graph over time, which is also a downloadable graph that can be shared as a JPEG, PDF, and CSV file, as well as the graph selection by subgroup that allows you to have the demographics, the downloadable features showing as well. A great thing about this chart is that you're also able to turn on confidence intervals. We can show that here, and the graph will adjust accordingly. And then let's say if you wanted to change where the zero base axis is showing on the y-axis, you can go ahead and click that here, and it will kind of tighten up the map a little bit. As we scroll down a little bit, as we scroll down a little bit more, we'll see that we have the map. There we go. The map function of showing what this particular indicator is showing for all of PG County. However, if you want to look at it more by zip code area, select zip codes, and it'll show you the comparison of where each of these zip codes fall in terms of like the percentiles being the 50th percentile being the best, 50th to 75th quartile being the middle, and the worst being the 25th quartile, which is these zip codes showing 20710 as well as 20784. Then as we scroll down a little bit more, you'll see that we have the table where the values are being pulled from. And then we also have the reminder here where you can show that this table as well as graph can also be exported as a CSV file to be shared and circulated for however you want to present for your information. In addition to the information we have here, when we scroll down a little bit more, you'll see that we have additional details at the bottom of the page, letting you see that there are opportunity and resource to learn more about similar indicators to this indicator that we are looking at, as well as other resources available that are related to the indicator around poverty. So that is data related to it. So we have advocating for a better public health infrastructure. We have toolkit resources, as well as some funding opportunities that can allow you to see what funding is related to this poverty indicator. This poverty indicator that we are looking at. So now that we have kind of looked over the dashboard overview and kind of looked at a specific indicator, we're going to go back to the dashboard, and actually I will show you how you can actually build out your dashboard to be more particular and specific to data that you are interested in on the platform. So again, we'll come back to the community health dashboard here.
And Tammy, just really quick, I'm going to interrupt. If anyone had any questions from what Tammy was just presenting, or if folks have familiarity with the site and have been using it, are there any features that have been particularly helpful to you, or any questions that you would want to ask Tammy while she's on?
Hi, this is Judy. I was wondering, this is phenomenal information to have at our fingertips as we try to understand what goes on in the community. I was wondering what our communications are, or how we're going to make sure that others know about what's this amazing resource besides this group. Is there a plan around that piece of it?
So Judy, we're going to be working with each of the work groups to get it out to the community. And we'll be featuring it in various newsletters. But if there are ways that folks can get it out to their networks as well, again, we have the live link here in the chat, and I can share this recording with you all to give you all a tutorial of the tutorial that Tammy is going through with us this afternoon. And then we can also speak within the health department as well to figure out how we can get this to our partners as well.
And then also I saw in the chat that question about who maintains the site. Conduit Healthy Community Institute, we maintain the site.
I'll say in combination as well with folks here. We maintain a lot of, this is Ashley Turner, the director. We maintain a lot of the data and some of the resources and tools on the site, but it's also, there's a great local content edition here where it's really designed to reflect your community and the work that you're doing. So take it back over. Go ahead, Tammy. Sorry.
Thank you. And then after this, I will also show you all our help center that kind of breaks down, that kind of has tutorial videos as well as more information in case you want to peruse the site on your own with some additional assistance on the side. So with the community health dashboard, yes, there we go. We were going to build a dashboard. Here we are. So we came back to the community health dashboard. So this was the first place I had taken us in the beginning of our demo. So when you want to come down and complete a drill down search and create your own kind of custom view of the dashboard, you can come here. This is accessible to anyone who comes to the site. So it's not just particular to any specific individual. Everyone who comes to the site has access to come here and do so. So to build out your own kind of dashboard, you just come over here to the advanced search feature, click into that. All right, and then it'll take you to this field that allows you to build a custom dashboard. From here, you can filter by a series of categories, and this is pretty much a great opportunity to compare information and data between geographies, as well as looking at indicators on a side-by-side view, for example. So let's say for this example, again, we'll let's still keep it to Prince George's County that we want to filter by. And then if we want to look at a specific topic, we can kind of look at, since we're talking about poverty, let's go to access. Let's see, healthcare access and quality can be the topic that we're looking at. Your option to filter by population. So if you want to get more specific, and let's say how on the previous indicator, we're looking at adults 65 and plus, and you want to focus on adults within your search, you can specify your population from here. Next, you have the option of filtering by classification. So if there is specific area classification, such as physical determinants of health or social determinants of health that you want it to be specific for this dashboard, you can go ahead and select the classification from here as well. Next, you can filter by comparison. So let's say you wanted to compare the dashboard that you're looking at to the Healthy People 2030 target. That can be one comparison, or even to Maryland counties in general. So not just looking at PG County, looking at other counties, you can select that from here as well. And then again, we have disparities that you can search through. So you can filter by subgroups, gender, age, ethnicity, and then as well, if it was a specific source that you wanted to have your dashboard focus on, such as the ACS survey data that I talked about previously, or even let's say specific CDC places information, you can filter from the sources here. But just to make sure that I have like a broad enough comparison on this one, we're going to go ahead and do this by location, press search. Okay, and then we have our built dashboard. So you can see that this dashboard is very similar to the all data dashboard and the disparities dashboard that we had seen previously. From here, you can see that it is showing again the actual health topic and the subtopic that we're looking at. Since the area of focus we're looking is PG County, all of the indicators that are here are reflection of Prince George's County. If we want to be more specific and let it be to a specific, let's say, zip code, I can actually change that real quick. Let's go to it's actually my county. There we go. You'll see that the list had shortened a lot compared to the whole Prince George's County. So just like toggling through between like the different filters will either give you a broader amount of data or a smaller amount of data, depending on how specific you want your dashboard to look to actually look like. Similar to the all data dashboard, you still have the same feature to kind of turn this into a card view, where you can save the information, as well as turning on and off the colorblind, where you get the thumbs up and thumbs down. And let's say this is a search that you want to kind of like come to on a regular basis and just kind of see how the data is being updated or even being shared. You have the option to come here and save a link to this search, which is where you have the option to share with others, as well as you visit on your own. The link will always remain the same, even as the data updates. So if you want to print or save the dashboard as a PDF, you can also do so from this icon as well. So again, as we're showing the curated dashboard that we just created, you still have the great legend on the side that kind of breaks down again what we're seeing in terms of the comparison, and then the great little help feature that takes to the help center to show more information on what we are looking at. Before I show you some of the articles on the Help Center, I wanted to kind of open it to the floor if folks had any questions or anything else you wanted to kind of follow up on things that I discussed. I'll also check the chat.
I just want to say that this is so impressive, and I've used this, and I know our team has used this to pull data and look at different statistics to drive both grants and programming. So thank you for building something that's so usable for people.
Of course, you're very welcome. And then I'll also put this in the chat for you all to utilize. This is our Help Center. So as you get a chance and kind of review the PGHealthZone and get more familiar with it, the Help Center is a great resource that we kind of push out to all users that come to the platform. Not only does it give you the opportunity to kind of see like video tutorials on how to go about using the Help Center, utilizing data on the actual page, like the indicator detail page you went over, or even just like running reports all together. This is a great one-stop shop that gives you a step-by-step tutorial on how to just run through everything that we just discussed. In addition to that, if you want to learn more about, let's say, the data and the dashboard itself, you can click in and it will give you more information about how the data is being viewed on the actual platform, how you can download data, look at maps and content, even giving more information about confidence intervals and outside logical limits. So it's just like pretty much a great hub that folks can pretty much come through and look at all the information available. So I think, yeah, I dropped the Help Center link in the chat as well. So definitely recommend if you have a chance to kind of look through and just like explore the resources we have there. I will go ahead and stop sharing.
And Tammy, you have a few questions here in the chat asking about data sources specifically. So Anya asked, how many data sources are utilized?
And for that, Ashley, I'll kind of tag you in on that one.
Yeah, sure. It's a good question. It varies platform by platform depending on where our client is located. So typically it's a combination between national sources such as like the American Community Survey, National Cancer Institute, and local like state-specific sources. And I think we do pull quite a few from the state of Maryland. I see Gautami is on. Gautami, I don't know, or George, they're specific on our data team. So behind the scenes with all this indicator data, we have a data team that manages and is checking the sources, making sure we're updating the data when they're updating the data. So I know we have a few folks here. I want to say about 30 data sources, but I don't want to like throw a number out and be completely wrong. So I don't know, Gautami, if you have a better sense for the number of sources.
I am looking up for that information as well to get a specific number. But to add to the names of the state sources, so Maryland Griffiths is where we maintain data from, apart from Maryland Department of Health and Mental Hygiene, Maryland Yearbis, I mean the Youth Risk Behavior Survey, and Annie EKC specifically for Maryland. Let me just double check on the exact number and place it in the chat if that's okay.
I think it's over like 300 indicators spread across 20 to 30 sources, national and state sources. That's a quick estimate from me.
Thank you, George.
Thanks, George.
And then another question here in the chat from Sharon, is there a place where it lists all the data sources and years? Tammy, I know we have an internal feature, but is there anything that the community could look at specifically?
On that, Ashley, I think I'll also pull you in on that one.
Sure. So on the front end, it's not source specific, but you can get a full indicator list, and that indicator list will also provide at what geography there's data points available. So whether it's the county, zip code, census tract, or census place. So Tammy, I don't know if you want to share your screen again. We can show that really quickly.
Yes. I just clicked into it. Let me go back so you can see how I got that. So this full indicator list right here.
Mm-hmm.
There we go.
Yeah, so this will give you kind of by topic and subtopic area, the full list, and that is exportable into a CSV file. And then to figure out where the source, what the source is for that indicator, you would just click directly on the indicator itself, and it will show you on the indicator detail page the source that it's coming from. And then Taylor, there is that larger export on the back end, and that is something that we're comfortable if you have a request and you want to share that, that can be shared, especially with this group.
Thank you, Ashley, and thank you, Tammy. Sharon and Anya, were there any other questions that you wanted to ask related to the questions that you put in the chat?
We can also, as follow-up, if it would be helpful, just provide a comprehensive list of all of the sources that we're pulling data from for your site. If that would help this group, we can absolutely do that too.
I didn't have any other questions. It's just, sometimes data sources differ. And so I always like to look at where it came from and what year the data was from, because even just when you were showing little examples, I saw places where I had seen different data, different numbers related to the same sort of data element.
Yeah, and different data sources use different methodologies as well to kind of come up with their numbers. So I would agree it's important to do some of that homework and look at how they're calculating the data.
Yeah, thank you.
Mm-hmm.
Are there any other questions specifically about those data resources that Tammy just went over, or can anyone think of any other resources that would be helpful in your day-to-day when you're putting together grant applications or reports? Anything that we can take in mind? Because keep in mind, we can develop the website however is in our realm, but we want to hear from the community what would be best and most useful for you all.
I have a quick question. So the intent for this health zone is really about population health data and not necessarily about services and where to find them. Is that correct? Or do you want to, or is there going to be or supposed to be a section that also talks about services? It kind of gets to Ms. Maxwell's point about giving people resources, or is there another place where people would go to find resources?
So Ray is going to go into showing our coalition resources. And so we can take a look. We have our behavioral health provider list, and then we'll also be working to integrate Find Help. And we can also work on a section that would highlight some of our health department programs and also link folks back to our health department site. And I see, Mr. Taylor, you have your hand raised. And Mr. Taylor, we're unable to hear you if you're speaking.
Okay, can you hear me now?
We can.
No, I was just thinking about the application for the, I use it all the time for, pulling grants together and searching out the data, but I think that this would empower the community health workers when they go out and visit the various municipalities. And then they can break down the data to show in that municipality some of the status that they may not be aware of. Does that make sense?
Certainly. I know we have some folks from health and wellness. Caitlin, if there's anything else you wanted to add to that.
Yeah, I think that, hi, Mr. Taylor. I think that definitely makes sense. I actually remember during COVID, we were doing some outreach in Temple Hills, and we had said, like, this is, the zip code with the highest rate of positivity. And the pastors there who we were working with, they were like, oh my gosh, like, we didn't know that. We wish we had that information more regularly so we could tell our community, like, we got to start working on this. We don't want to be the worst zip code, for COVID in the state. So I think there's definitely something to empowering people with that information. I like the idea of training the community health workers on this so they can have it at their fingertips. So good idea, Mr. Taylor.
Thank you. I think it works. I have one of my community health workers out now visiting the municipalities in support of my upcoming conference. So I know it works. Thank you.
Thank you, Mr. Taylor. And Anya, I see your hand.
Thank you so much for going over this very valuable resource. I have a question about sample size. I know that typically when you get into a more granular level, there may be less responses available, and therefore you may not have sufficient really number of responders to really draw conclusions and to have a representative sample. So I was wondering if this is something that you have seen as you were putting this together, meaning that maybe like some indicators are only available at the higher level and not so much at the more granular level. If you can speak a little bit to that. Thank you.
Yeah, George or Gautami as our data experts.
Yeah, it would depend on the source. For example, a lot of our state sources, Maryland state sources, they would only be available at the county level. But in terms of sub-county geographies like zip codes, census tracts, census places, we have two really good reputable sources nationally from the American Community Survey. And because they're aggregated over 5 years, they're able to have enough of a sample size to report at those sub-county levels. Same with the Centers for Disease Control and Prevention with the places source. And those have more like behavioral risk factor surveillance system indicators.
And I see Denise's comment here in the chat asking about getting this out to the community. So again, this is just our starting place for being able to bring exposure to the site. So we wanted to get the site in front of you all, so you all can see the resources that we have. I know we have some new members who are on the line, so wanted to introduce PGC Health Zone and then also introduce some of the orientation materials that we've put together. So Ray has been working behind the scenes to get together a cheat sheet with some of our coalition resources. So folks will be able to see our behavioral health provider list, how to get on that list, how to access various things. And of course, we'll include the link to PGC Health Zone. So we'll be able to share that far and wide with the community. But of course, if there are other ways that you all suggest that we get this out to the community or other helpful materials that would be useful, again, Tammy wrapped up the presentation there with showing the Help Center. So, you know, anytime that you're on the website and you get lost, you can go to that Help Center and they'll walk you through in videos or articles to be able to understand and be able to interpret the information that you are seeing. So again, if there's any information that we should pull out specifically and any of those materials highlighting the resource, please let us know. We want to know from your eyes and how you all are accessing it, what would be helpful for others to know in the community. So this will be an ongoing initiative that we'll continue working on through the work groups, but I'll also include my email information if anyone has any additional ideas for how we can get this out to the community and what would be the most important information to highlight about being able to use it and access it to the best of its capabilities. Any additional questions for Tammy, Ashley, and the Conduit team? Alrighty, well, thank you again, Tammy, so much. We are so excited to have you on board. For those, I don't think I introduced Tammy. She is actually a native to Prince George's County, so really excited to have a fellow Prince Georgian working with us with the website, and certainly look forward to future partnership and continuing to make the website as best as it can be. So if anyone has any ideas, if you want to go through it through the next week and take a look, a deeper dive, see how you are accessing it, see what gaps we have, please do keep those in mind and we will continue refining the site moving forward. But thank you again, Tammy, so much for putting together the presentation and for sticking with us so late this evening, and to all of the Conduit team. It is such an honor and such a pleasure to work with you all.
Of course. Thank you so much for having us.
Thank you. Well, have a good night.
And next, Ray, if you want to go into a short presentation. So Ray is just going to do a quick overview of our coalition resources. So the nice thing about our PGC Health Zone is we have all of these wonderful data resources, and then we also are able to highlight a lot of the great work of the coalition. And that's where you'll be able to see some of those resources, and we'll be able to feature more of the coalition successes. So as you take a look through this, again, do let us know if there are any announcements that you would like to bring up, or any ways that we can really make this website feel like the community, because it is owned by you all. So please do let us know how we can continue to enhance it.
You ready for me? Hi, everyone. Can you hear me all right? And is my screen sharing properly? All right. So I'm Ray Wallace. I work with the Prince George's County Health Department, and I'm the other side of the website. So I help to keep up the content and the banners. And so today we're going to get a little into additional ways that you can engage with the PGC Health Zone as a member of the coalition. And so let's go ahead and just dig right into our site. The first piece that I wanted to share with you all is if you hover over this area that says Health Action Coalition, our drop-down menu includes all of our work groups, as well as a spot right here at the bottom that says PGHAC calendar of events. Now, this is a wonderful tool because you all can submit your own community events to this calendar. All you have to do is simply click right here, add events. It's a very simple login, and once you finish logging in, which takes literally a couple minutes, you enter your information for the event, like our quarterly meeting, and it populates onto this after I review it. And so this is a great option. This is also always included in our newsletter, a snapshot of all of the events that we have coming up that are related to the coalition. So please do not be shy. Add your own events. Make sure that you can also share this link to this exact calendar to others if you like as well. But this is a wonderful tool. The next piece I wanted to show you is that when you are on the coalition websites, you'll notice that we have several banners. We have information about our co-chairs, about our coalition, all of the above. Now, let me actually give you an example with health equity. Here, each work group, you own the content that lives here. And so if there's ever anything that you'd like to update, especially over here in your banner section, you absolutely can. This is a recent presentation that was done by La Clínica del Pueblo. And so this is a wonderful video to watch if you're all interested in seeing that presentation. But all of this is here. It's self-driven. So I'll update based on what I see happening in the coalition, but you all also can share directly with me any updates that you may have for your site. And so please let me know as things come about. All you have to do, if you want to see any updates to your individual banners on each of the different coalition work groups, is to email me, and I'll of course, include all of that information on the cheat sheet. The other piece I wanted to share with you all is our behavioral health providers list. This list includes many of the behavioral health practices, different services that are available to the community within Prince George's County and in the area. And so if you all know or are part of a behavioral health group that wants to be featured in this list, all you have to do is follow just some simple instructions that I'll share again in that cheat sheet that has all of the information. And so while we're here, I'm just going to stop sharing for a moment, and I'm going to pull up the cheat sheet so that you all can see exactly what I would need for you to make any of the content driven or design edits within the site. So let me pull up my PowerPoint. Can you all see my PowerPoint at the moment? Sorry,
we can now.
Yeah, good. Okay.
Yeah.
Okay.
Yeah.
Thank you. I can't see your wonderful faces. All right, so this is where I originally was speaking of adding the event. Below here, you'll see access to the behavioral health provider list. Now, in order to be added to this, what you'll need to do is you'll need to send me an email. Here's my email with just the following information: name of business, the address, email address, description, and list of services, and of course, insurance is accepted. Now, the other piece, in order to contact me to update a resource, a feature, to add an article to your individual work group page, it's a similar setup. All you have to do is email me with the information that you'd like, or a link to the resource that you'd like to be shared on the site. And also on the cheat sheet, you'll have a link, you'll have a space right over here in order to join our newsletter, which goes out monthly. And that newsletter, of course, includes our quarterly meeting information. It includes our virtual meetings, so you can watch them and catch up to them online. It includes important resources, important articles, and important events that might be coming up that will be related to our coalition and improving the health in our communities. And so that's pretty much a snapshot. I didn't want to take up too much time. And I'm just going to check the chat and see if we have any questions. And it's looking pretty good. So yes, we'll be sure to get out that FAQ after the meeting, so you can easily and seamlessly just ensure that you're getting all the information over to me that you want to keep your site up to date, and just include any of those wonderful resources that I've been seeing popping up lately. So thank you.
Thank you so much, Ray. And any initial reactions or any resources that we would want to add? to the pages. So again, each work group has its own page within the website. We'll have that calendar. We have the behavioral health provider list. We're going to be working to integrate Find Help. And so folks can go in and put their zip code in and be able to access local resources related to the social determinants of health. But is there any other information you all would suggest just from first glance that we would want to add in terms of the coalition or that data side of things?
Yes, hi. My name is Denise Robson of Community Engagement. Oh, I didn't know my camera went back on, so I'm up here running around trying to get some stuff done like I didn't late. How y'all doing this afternoon? Rakia, can you send in the chat email address? We can send you our information to add our events, or well, I'll share with the CEO to send your email address so I can share that with them. And I'm sure we can share our events that's coming up, and and check other events that's coming up as well on the PGC calendar.
Absolutely. I'll actually go ahead and put the whole FAQ in the chat. Does that work for you?
Yeah. Okay. Yes. Thank you.
Okay.
Yep,
all right.
absolutely.
No problem.
Yeah, you may want to take a look. I was unable to share documents in the chat. Teams is doing that weird thing. So I don't know if we're going to be able to share the entire document, but we may be able to pull out some specific information there. Ray, could you actually take us back to that calendar feature? I just want folks to, again, see where they can add their event. And then are there any features where if we have reoccurring events, or if we want to put up a flyer, for example, or have like an image? I know Mr. Taylor has a brilliant conference coming up and want to make sure that his flyer is included there.
Sure. Let me share that screen again. One moment. Okay, let's get back to the calendar of events. And so when you go in to add your event, what will happen is after you've logged in, you will get a screen for you to enter all of the information. That information will also include whether or not it's a reoccurring event. If it's a reoccurring event, you'll just select reoccurring, and then you'll state the dates that it's reoccurring, and it'll automatically populate onto the calendar.
Wonderful. And then I see like a graphic down below so folks can add like PDFs or JPEGs.
Yes, you can add PDFs, you can add JPEGs, you can add, if you send me, JPEGs are better, but if you send me a PDF, I can always convert it if you're having any difficulties, where I can attach, or you can also attach it as a link. So you've got a lot of options for this piece. And as I mentioned before, it's also included in our, let me just show you. It's also included in our monthly newsletter. So at the bottom, you'll always get to see a snapshot of all of the events. And so it's an additional way for the calendar to be publicized. And so it's just an awesome way to keep community going, to see what everybody else has doing, and an opportunity to engage folks that you may not get to on the regular. And the same goes, I'm going to go back to the site. The same goes for here, for any of the banners as well. If you have an image that needs to be attached, or if there's a PDF that needs to be attached along with an image on one of the banners, all you got to do is just make sure that's included when you share it with me. And so we can make sure we can make all of those changes.
Thank you so much, Ray. And I'm going to bother you for one more thing. Could we include the link to join our newsletter in the chat as well?
Oh, of course. I'll just take pieces out of the FAQ and drop it right in the chat. I'm starting with the behavioral health list, so you all will see a barrage of messages from me in a moment.
Sounds great. And please do share these resources far and wide. Again, they are available to any of our Prince George's County communities. So want to make sure that folks are aware of these resources and are adding their events again, so we can make sure that we are participating in all of the great events that are going on throughout the county. Any additional questions or any comments that anyone would like to add?
I think this is Greg Taylor again. I think someone asked the question if it's possible to post resources. So kind of expanded. I know doing the Caitlin was doing the local health disparities, and we've identified people in the community that needed either health or social service, but then we had to point them somewhere where they could look at it. But if they had on this platform here, basically some general resources that they can go and find it themselves.
Yeah, and I think with that integration of Find Help, that will especially be able to connect folks to so many resources and will really take the burden off of us from having to manage those resources and follow up to see if contact information is still relevant, because Find Help takes care of that on the back end of things. So we'll be adding that page very soon, and we would love for you all to pilot test it and see what that looks like. Again, if that is calling out any of those specific resources, we can also add those to any of our work group pages. So feel free in the meanwhile to send me any of those resources, and happy to work with Ray to have those called out on the website as well. Alrighty, and any additional questions?
Tyler, I'm Marlene Orante from Horowitz Center for Health Literacy at the University of Maryland. I'm just wondering if you have this platform and the website in another language, for example, French, Spanish. Our population, Latino community in Prince George is large. It's probably large. So it is, if you put in some resources, I think that should be in Spanish. I think this is, I'm just wondering.
Yes, so I believe, and Tammy, please correct me if I'm incorrect, but using Google at the top of the page, it can usually auto-translate into whichever language you would like it to be in. Does that ring true for the data specifically too?
No, you just for the community, or also for the community health worker, that many of them speak Spanish, and then could be more easy for them just to pull some data or some information or resources in Spanish, instead that they can translate or go to the translation, or I don't know, more easy for them. Yeah, I know that this is beautiful and very with a lot of information, I know, but our community, how is our community, Latino community especially, or another immigrants community, they need resources and
so yes,
another
Ray,
language.
we do have that functionality, and I could actually show you.
Mm-hmm.
Okay, yeah, so you do have the option of coming up to like the Google Translate, and once you select your language of interest, so on this one specifically, Spanish, it will update. Just did it.
Oh.
There we go. It will update. So everything will be updated into the language of choice, except for infographics. So infographics will stay the same, but everything else that was entered in by us and within the website itself will still show and be updated through Google Translate.
Yeah, thank you. Thank you,
Of course.
Tammy. Yeah, thanks a lot. Yes. And another thing is just to incorporate about health literacy. Health literacy is part of the equity. And also, I think that to write in plain language and not jargon could be great. But what about to put something that can be always part of implementing in the health department about health literacy and about plain language and language access and I don't know, a lot.
Absolutely. And I don't know, Taylor, if you'd like to share about what the Health Equity Group is working on currently that's almost finished.
Yeah, we've Marlene is a part of that health equity work group, and something that we're always, looking at whenever we get our announcements, seeing again how we can be very clear in our call to action. So if we ever, respond back with resources or, ask folks to take a look at that, we can certainly take a look at those checklists from the Horowitz Center for Health Literacy. I know you guys have some wonderful plain language resources. Would love to include those on the website, and just again increase awareness of that as we start to feature more content on the site. So thank you for mentioning that, Marlene. Really appreciate it.
My pleasure. So if you need some training, I assume that you, Taylor, you received some training about health literacy. I'm not sure. Yeah.
Marlene, I will be there at the University of Maryland tomorrow, actually, for some training, some
Yes,
health literacy
of
training.
course.
So I will see you there.
Great to hear that. Yeah, we will see tomorrow in person. Thank you very much.
And
Thank you, Marlene.
I
want to give
appreciate
a quick little shout out to the group, all the work that the Health Equity Group has been working on to help build out I don't know if you've shared this with the group yet, to build out an opportunity to help train the community with a training resource that touches on a lot of areas, including health literacy and using plain language. So it's a big shout out to the Health Equity Work Group for all your work that you've done to help us pull that together.
Thank you so much.
And Deborah, I saw your hand just a second ago. Did you have something that you wanted to add?
Yeah, I was gonna add, I think that that's really great, the health literacy piece. And Marlene, thank you for, mentioning that as well. And I think we have had conversations, and we're going to continue to have conversations with Conduent about, just making sure that the website is, I think, the audience for the website, depending on the person, it may not be, easily understood at all levels or all health literacy, points. So we are going to work with them to kind of incorporate some of that plain language and making it a little bit more understandable. So thank you for mentioning that.
Yeah, we are here to support you, to assist you. You know that, right? Yes. Thank you.
Thank you, Marlene. And Miss Denise, I see your hand.
Yeah, I missed it. Did you say it could be translated in Google Docs?
So Google does the translation.
Yeah, so it's not Google Docs. So on the actual platform itself, when you go to, and let me actually share my screen again so you can see what I'm seeing.
Yeah.
It does the translation on the actual page itself. So it doesn't take you to like another document or so. It keeps you on the web page. So if you come to the top right corner where it says translate, you have the option to, let me see, go back to the original. Yeah, so it takes me back to English. But if I wanted to look at another one, we have Spanish, French, Arabic, Chinese, Filipino, Haitian Creole, Korean, Afrikaans, and Vietnamese. So you can select any of these, and then once you select the language, the web page itself will update, and then all the actual content on the page will be updated to that language, except for infographics.
Thank you. I think you showed that at the last meeting. That you're right. Okay, got it. Thanks a lot.
Of course.
I just want to add that really I'm very proud to be part of the Prince George Coalition Equity Work Group, and also be part of this, because I'm part of the other counties, and you guys are doing a spectacular and awesome job with your website. Really, really, I so proud that all the time say, "Did you see the website of Prince George?" I'm always putting as a model, really, because I didn't see another county doing the same thing. It's you guys are unique. Thank you very much. I'm not living there, really, but I would like to move there, really. But thank you.
Thank you, Marlene. And we are so glad to have you, and really glad to have the University of Maryland's partnership and all of the great work that we're able to do.
Me too. I'm so thankful that you having me here. Yeah, it's a pleasure.
Thank you so much. And thank you, everyone. This website is really to feature all of the great work that you all have done. And so it is a true mirror of you all and all of your greatness. So take pride in knowing that it is a representation of all of the work that you've done thus far and will continue to do. And we will continue to cheerlead and yell from the mountaintops with our megaphone what great work is going on in the coalition. So thank you so much for producing all of the great work that we have such great pleasure in getting to share with the community. Alrighty, so I am going to go ahead and move us into our community announcements. So first we have coming up actually tomorrow at 10 a.m. at the hotel at the University of Maryland, a federal employee and career transition and resource fair. So we've heard a lot from folks. A lot of folks have been impacted by some federal employee layoffs. And so we wanted to share this resource with you all happening tomorrow. Again, just really great opportunity for folks to get connected to different employers, get some resume feedback, and just again connect with those county level resources in terms of planning what is next. So I will go ahead, let me put the link here in the chat for you all. So that registration link is in the chat, and please again share this with your networks. I know it's super last minute, but if anyone can make it tomorrow morning, I think this will be a source. Next, there is a mini grant opportunity from our friends at the American Heart Association. I will share with you all that request for proposals. So it's a $500 mini grant opportunity for clinics who are working to address blood pressure and type 2 diabetes. So I will share with you all that, and that deadline for application is April 25th. So you'll be able to take a look at some of the criteria, and please again share it with your networks. I think they'll have opportunity for 6 clinics here in Prince George's County to be awarded. So please do make sure that you are sharing that with your networks. Next, really excited to announce the Summer Youth Enrichment Program is again being offered this summer to Prince George's County youth ages 14 to 24. This is a wonderful professional development opportunity that will offer students a $500 stipend for, I believe it's about 6 weeks of work, and applications are due by March 31st. So I've included in the chat an application link for folks to apply to that Youth at Work program. But again, really happy to be able to share this enrichment program with you all, and please do share with any youth that you know, again, ages 14 to 24. And next, I don't think Mr. Taylor is still on the line with us, but I hinted at it earlier. The Vibrant Health and Wellness Foundation is hosting a Partnership for a Healthier Prince George's County Conference on April 5th at the Prince George's County Community College from 9 a.m. to 3 p.m. So if you are interested in getting in a room together with a lot of like-minded folks, community-based organizations, and our health partners, please join us on April 5th. Look forward to the discussion there, and I've included that registration link in the chat.
Thank you. I'm still here.
Oh, I'm sorry, Mr. Taylor. Was there anything you wanted to shout out about the event?
No, one of the things, Taylor, just to couple what you mentioned about the federal employment, I have reached out to Prince George's, the Maryland, what do they call it? Maryland Health Exchange. And they will be at the conference signing up people that doesn't have insurance. So that's going to be a big game changer.
Wonderful.
And
yes, I will be sure to share out this flyer with everyone.
Yeah, it's going to be a lot of fun. I mean, it's I'll give you a little tidbit of information. The flavors from Africa. So the meal is going to be around flavors from Africa, and it's going to be all plant-based. So should be interesting.
Awesome. Well, I know I will be there, and I am looking forward to it. And like I said, I will send out the flyer with folks. Be sure to share this far and wide, and look forward to convening with community on Saturday, April 5th.
Yeah, that's one of the things, Taylor, we try to do is pull into the business. The business sector have a dog in this fight. And too many times, I mean, the business section have employees, but, at the end of the day, the business is gone. And so we want to bring the business community to the table. And therefore, we were outreaching to each municipality and encouraging them to invite the local business in their area to attend the conference as well.
Wonderful. Well, thank you so much for all of your hard work to put on this event and all of the great work that you're doing in the community. Certainly look forward to celebrating this success with you.
Thank you.
All right, and next, for those who are part of our health equity work group, last month we had a presentation that we wanted to share with you all from our partners at a federally qualified health center, La Clínica del Pueblo. They did a participatory rapid appraisal, and they have their report that they are sharing with the community, as well as the meeting recording, so you can take a look at the specific Prince George's County level data, and they have some really great policy recommendations. So again, as we're talking about data and expressing different needs of the Prince George's County Health Department, or from the Prince George's County community, we wanted to make sure that we were sharing out this assessment so you can all think about what it means for your grants that you're applying for and the services that we are able to provide. So that report is in the chat for you all if you would like to take a look at some of their findings and as well as their policy recommendations. And that was the last community resource that I had to share, but would anyone on the line like to share any upcoming community events? All right, we'll continue to use that calendar feature that Ray featured to you all tonight to add your community events. And lastly, if folks would like to get involved in any of our work groups, here is our work group schedule for our health equity work group, our behavioral health advisory group, our community care coordination team, and lastly, our healthy eating active living work group. So here is the monthly meetings. Please do email PGHAC, the PGHAC email, to get involved in any of those work groups. I can add you to our notes or our meeting invite as well. So look forward to seeing you all in these meetings as well. And that wraps us up. Dr. Levy and Dr. Little, I will go ahead and hand it back over to you to close us out.
Well, I'm blown away by all of this. This is a terrific work, and really, these are amazing resources that I hope people will take advantage of. Taylor, thank you. Ray, thank you for putting all this together. Temi, thank you. And I'm excited to play around inside of PGCHealthZone so that I can, get the latest data on everything. So it's terrific. So thank you all for participating and giving up your evening tonight when it's dinner time, and we look forward to seeing you in June or sooner, hopefully, at some of these events. It's going to take us all to work together to really drive change and really help the community stay again healthy and be healthy. So thank you for all that you're doing. Stacy, do you have anything you want to add?
I have nothing to add other than thank you. This is like Dr. Levy said, this is dinner time, and you took that time to hang out with us and learn more about what we're doing in the county, and we appreciate you and all the work you do. So thank you so much. Have a good evening, everyone.
Thank you,
Bye,
everyone.
Have a good night.
Bye.
Good night.
Take care.
Thanks, everyone.
Good night, everyone.
Thank you. Have a great evening. Bye-bye.